Hey, welcome back, everybody. It's time once again for another episode of Health Talks with Dr. Trinh. The one show, the only show that shows you the path to a healthier life, one conversation at a time. And today, well, we're going to have a conversation we don't often have. We're going to talk about gerontology in low-income communities. I got to be honest, I know very little about the subject, but fortunately we have somebody who knows a lot about the subject here. Welcome, if you will, Allison Cuff.
Thank you so much for having me.
So what is gerontology in low-income communities? Lay it out for us here. What is the work? What's the need?
So I work for Jamboree Housing. We provide low-income, affordable housing all over the state of California, from San Diego to Sacramento.
Right.
And I specifically work at senior communities in Orange County. So we do have, let me think, 1, 2, 3, 4, 5. We have 5 senior-specific communities from Irvine to Anaheim. And I work in Huntington Beach. And basically, the goal is to provide services to cover the needs of the aging population in our community so that they have the ability to age in place. We want them to be able to be comfortable, learn new things, be taken care of in the place that they live. And so we provide that. We're resident services coordinators. I am a community impact supervisor. So I supervise the other coordinators that are at the other properties, as well as my own in Huntington Beach.
And what do you do to keep low-income seniors safe, secure, happy at home? I mean, that's got to be a difficult task because they can't pay for all the services that others pay for here.
Right. It's very difficult, but also very rewarding. Everyone works, 8 to 5, but really it never really ends at 5.
Yeah, right.
Or it never really starts at 8
because they fall at midnight, or they can't get off the toilet at 2 a.m., or they are frightened at 8 o'clock at night, or they get disoriented or something. I mean, all sorts of things happen to people. These aren't. I'm assuming that these aren't all perfectly healthy people here.
No, not everyone is perfectly healthy, and we make sure that we have partnerships out in the community. We make sure, so each property has a property management company that manages the property like any other, apartment complex.
Right.
So we have that. So we have maintenance gentlemen who live on site. They are available for, after hours emergencies. Generally, it's for property related stuff. However, since they are on site, we make sure that if there is some other kind of emergency, that they know to call 911, get the ambulance over there, or the police, or whoever it needs to be. We also are basically on call ourselves. So if someone calls us and it's definitely an emergency, we make sure that we get someone over there that needs to be there. We also make sure, a lot of the partnerships in the community, like Dr. Trinh, he comes and does health talks. They know who to call if they're having some kind of medical questions or anything like that, medication management. We just make sure that they have someone who has the answers that they need at any point in time.
So let me see if I can summarize this again, see if I can wrap my head around this. So Jamboree Housing, you guys create housing. You manage, you build them. What do? Do you buy them? You build them? You renovate them? You set them up? Low-income housing projects, right?
Right. It's all different. So some of them are new builds that we build from the ground up and we own, and then we hire property management companies to manage them. But we also have a Jamboree staff on site at all of them to make sure that we're doing the services. Some of them are renovations. The one in Huntington Beach, Emerald Cove, was a renovation that we purchased from the city. So the city used to own it. Mm-hmm. We purchased it from the city, renovated it all, and now we own it solely. So we're able to keep the rents low.
How do you do this? How do you get grants? Do you get donations? How do you afford? I'm assuming that you're a not-for-profit organization.
Yes, absolutely.
So your goal is to provide low-income housing at a time when there is no even reasonable middle-income housing for many people here. I mean, low-income housing is the holy grail. We don't know where to put people who can't afford $3,000 a month.
Right. Yes, we have a lot of properties. However, we don't have enough. The need is still there out in the community. There are lots of people who still need it, and we can't build fast enough. But we are continuously building. Funding comes from a whole bunch of different places. There is a lot of federal funding, there's state funding, there's donations, there's partnerships with other companies. It's all different. A lot of the new funding these days, the last couple of years, are from the government to convert motels. So we also do permanent supportive housing. That could be for seniors, families, individuals who were chronically homeless. That's a lot of the new funding that's been for the last few years, is to convert the motels. And of course, there's services there as well. There are seniors that live there also. But the long-term plan is, if there's seniors in the motel conversions, that we always try to find them a unit at one of our senior properties. That way, they're a little more stable long-term. So yeah, the funding comes from many different places.
Well, God bless you guys for finding the funding and for taking this task on, because it's the number one issue facing Californians these days, a lack of affordable housing for everybody, particularly for low-income families, particularly for seniors in the low-income community. Let me tell you a story here. I love to share stories, so this is a story I've kind of shared several times before, but I think it frames this. It puts a different perspective on what you do. So I took care of my late aunt. She never had any children, my mother's sister, and she lived to be in her 90s. And she was just she was a little secretary at some company, and by the time she retired, she had a little pension of $1,000 a month and Social Security. She made $2,000 a month. And she thought that'll take care of her. She didn't know she was going to live to be 93. She didn't know she was going to live what the costs were going to be in California.
Right.
And so she lived out in the desert. She'd always lived by herself. She was very independent-minded. And as she got older and older, it became more and more obvious that she shouldn't be living alone. But what's the option? She didn't want to move in with me. And if I did, what am I going to do? I have an upstairs bedroom. Am I going to convert the dining room and put a bed there? She can't walk up and down the stairs. She had she had a rare form of blood cancer that meant she was very lethargic. She was killed all her red blood cells. She had to take these shots, Procrit shots, to increase her blood count. So she was overweight. She was lethargic. She couldn't move very well. Couldn't move up and down the stairs. Didn't want to move in with me. Couldn't move in with me. And if we did, either my wife or I has to stay home and take care of her, because she can't be home alone all day. She needs help. So instead, she lived in this apartment out in the desert, out in Palm Springs area. And during the day, she was okay. She got Meals on Wheels. They brought her some food. And a few other people would check in on her once in a while, but not many. She mostly just watched TV all day. And come nightfall, watch out. She would call me so many nights. I'm 2 hours away. I'm in Orange County. I can't get off the toilet. I can't, I'm scared. I hear somebody outside. And so what would she do? She had nobody to call out there. I couldn't come rushing out, 2 hours. I mean, in a real emergency, I could and did. But she called the police. And the police got so tired. And then they'd have to break down the door. Wait, I finally put a key outside and don't tell the police, here, you know where the key is when she calls you. And they'd come, lady, we're the police. What do you want us to do? We can't carry you off the toilet every night here. We can't. So they take her dutifully to emergency in the emergency room and throw up their hands and say, you've got this blood disease. Of course you're weak. Of course you're overweight. Well, you're 92. What do you expect us to do? And they'd send her home. And she kept waiting for some magic bullet. So the obvious answer was her doctor kept saying, you got to put her somewhere. Find a place for $2,000 a month. It doesn't exist. At least it didn't exist then. This is like 10 years ago. And so I went round and round and round, went to all the places 100 times. And I quickly discovered that there's almost no places that, let's call it what it is. There were no places other than I wasn't aware of what you guys are doing. No place that would take her, because they'd say, one, she's not poor enough. She had like $10,000 or $20,000 in the bank. She had to have less than $2,000 to have Medicaid. And then we found out the only Medicaid places, they're out in Bakersfield, someplace where it's cheap. They don't build Medicaid places in Orange County or Palm Springs. The land's too expensive. They won't take them. So nobody would take her. I have to come up with the cheapest was $4,000 or $5,000 a month. And we went round and round and round. She didn't want to go. She couldn't go. And so she stayed in her apartment almost to the end and finally broke down and put her in a board and care. That was the most reasonable thing. One of these houses where they take care of, and that was about $3,000 a month. And so I came out of pockets a month, and, fortunately for her and for me, she died after 6 months in one of these facilities. She didn't like it. She didn't want to be there. It was bleeding. It had already taken whatever she had and whatever I had. And so we had somebody on one of our shows years ago, coming to the end of the story here. And they said, from all these senior living facilities, I won't name them, but a big chain of them. And offline, I said to the guy, what do I do? And he said, I'm going to say this polite, not so politely. He basically said, you're screwed. There is nobody. We can't make any money with your aunt. We only want the top 10% that have a house, that can liquidate the house, can put all the money towards taking care of them. It's expensive. It's expensive to operate these facilities. Nobody is going after the other 80%, particularly the bottom 10, 20% of people here. Sounds like you guys are filling that void. Sounds like you guys are tackling that topic because, honest to God, I was stunned. There was nobody, no place to take her. Zero.
Yeah, we do our best to provide what we can. Sometimes there are those who need around the clock care. And so they need to go to some kind of assisted living facility where they do have the care of nurses and doctors and everyone. But like you said, insurance doesn't pay for it.
No.
They can't make any money. There are tricks to the trade. We learn over time from others who have had to say, if there's a couple and the woman had to put her husband in the nursing facility, we learned how to get around the insurance issue. Apparently you have to cancel your whole insurance so that you don't have any insurance, and then you'll be covered from the government. Which is really sad because no one's going to tell those people that, and they're just going to die.
Yeah.
And not get the care that they need. And it's horrible. It's absolutely horrible.
And here was what was really horrible. So the doctors would rail on me. I'd take her to the doctor and say, what is she doing living alone? She can't live alone. I said, give me an answer. Well, I don't know. Just find something. I said, you're the doctor. You're my only resource. You're the only one that you deal with this all the time. You must know somebody. Well, I don't know. We can't talk to anybody. I talked to them. She'd go to the hospital repeatedly. And I'd talk to whatever their social services person is, the discharge person, and they wouldn't know. They didn't give me a list of things. They would just shrug and they'd say, well, here's the assisted living. I said, we've been to all those. They start at $4,000 or $5,000 a month. She doesn't have that kind of money. I don't have that kind of money here. So what do we do? And on top of it, she didn't want to go to these places. When I finally put her in a board and care, I always tell the story, my sweet little old aunt, that day when I said, this is enough, we're taking you, you're going, done. She called me every 4-letter word in the book. I didn't even know she knew these words. I'd never heard her talk like that in my life. She thought I was killing her. And in some ways, I think I did kill her. I mean, she didn't respond. She didn't like it. She stopped eating. She faded away rather quickly once we put her in a facility there. Would she have lived longer at home? I don't know. But I'd say to her, what was the choice? Because every night she was alone, and every night her imagination would start working or her weakness would take over. And not every night, but just about every night.
Right.
It was like, is she going to make it through the night? And I don't know. I got to believe there's lots of people out there. She had me. I think there's a lot of people out there that have nobody. Their children are far away. Their spouses died. They're divorced or whatever. I suspect there's an awful lot of people hiding in plain sight, holed up, and nobody checks in on them. Nobody looks at that crazy old man or that little old lady over there, and they just get barely scraped by day with some sort of ad hoc hodgepodge group of neighbors, helpers, Meals on Wheels. They were the biggest thing. Oh my God, somebody came and little Tony would check in on my aunt every day. Yeah. That was a
Yeah.
that was a godsend to know that somebody looked at her today and she was
Right.
okay. Now,
Yeah.
telehealth may help, other sorts of things like that. I think there's lots of options, things like that, where they could check in remotely. You can remote sensors, see if she's taking her pills, see if she's taking this, all the stuff that goes through your head. But not everybody can take somebody in, and
Right.
and certainly most of these people don't want to be taken in or go somewhere. They want to be independent, and yet they struggle to be independent. That's got to be a real challenge today.
They want so much to keep their independence, and when they lose it, it's not an easy thing to give up.
Mm-mm.
But over time, when you seek assistance and you have assistance, you get used to it.
Right.
You start your new life with a little bit of assistance every day, so you're not necessarily losing all of your independence, but you've lost a lot of it, and it's not easy. And people do deteriorate fast when they are unable to accept the fact that they need help every day.
Yeah.
One thing, well, there's actually a couple things that we try to do. If we do see that someone is unable to stay independent, we try to bring in-home support services.
Right.
Of course, they have to income qualify. Then we have to fight with them about how many hours of assistance they can get per week. But that seems to be the best option right now, because these caregivers are able to come in for a certain amount of hours per week and be at the home with the resident. And it can be...
And who pays for that? Because Medicare doesn't pay for that.
It's the government. It's a government program.
Because that's one I didn't know exists. We looked for other sorts of assistance, and Medicare kept saying no, unless you're absolutely, I think it was less than $2,000 to your name, and you couldn't just raid the bank and take all the money out or whatever. They had all these things, but there really wasn't even any. At least we couldn't find. This is 10 years ago. Maybe I didn't look in the right place, or maybe it's changed. But I assumed that Medicare must have all sorts of programs. I couldn't find any. You're saying there are some. Is it through Medicare, or is it through other sorts of? It's
just through the government, separate from Medicare.
Okay.
It's a whole different, application. It's actually through the Orange County Social Services Agency.
Okay. That's what I'm trying to direct people and say, where would they go find this thing?
See, the problem here is that someone should have told you. Someone needs to tell people,
yes,
if my insurance can't help me, then they should know exactly where to send me if they can't help me.
And that was what shocked me. Nobody, this went on for years. I talked to everybody I could. I looked in the internet. We talked to these facilities. We talked to usually the most helpful people were when she'd go to the hospital, whatever they call that person that discharges you and talks to you, like a social service person. But even then, they're reluctant. They won't recommend anything. They can't tell anybody anything. They didn't have ready-made lists. Here's the programs. I thought they'd just hand me a sheet and say, okay, she qualifies for this. Go do this. There was no ombudsman I could find.
That's how it should be, though. That's how it should be. They need to up their game and be able to provide what people need leaving a hospital. Or even calling, they should be able to provide, because otherwise these people are left in the dark, and the families and whoever else is helping them they need to be able to be provided with the resources that are available. And it's horrible that those things are not provided.
I can't ring the alarm loud enough for those listening. I wasn't ready for this. She wasn't ready for this. And when it came, we couldn't find any resources whatsoever. It was only by sheer accident that somebody finally said, check out one of these board and care facilities, which I found to be in some ways the nicest, because you're at a home and there's only 4 or 5 patients there, and there's round-the-clock care, and they're the cheapest. They were like $3,000 a month, as opposed to all the others started at 4 or 5. And what shocked me is about all these assisted living facilities, every time they touch you, there's a bill. So you need me to come in and look at your pills? Happy to do it, but we charge you. You need me to take you off and put you on, transport you to the toilet and back? Happy to do it, but there's a charge every day. So there's the minimum, and then these charges add up. And I know people, God help you if you have Alzheimer's or some other dementia issue or Parkinson's or something else. There are facilities that will do that. But my next door neighbor had the same thing with his mother. He was spending $10,000 a month out of pocket. So what did they do? They took the house, they liquidated her old house. That's usually what you do, is you liquidate their house, and then you take that money until that runs out. And then and then the other crazy thing is, people have told me, this is another thing to think, I'm not trying to scare everybody, but I guess I am, is they're going to live a lot longer than you thought. His father had a stroke. He went through it first with his dad. Usually when you have a severe stroke, you don't live that long. He lived for like 10 years in one of these facilities. His mother
Wow.
lived for another 10 years in one of these facilities. He's spending $10,000 a month. Unfortunately, he had a good income, but they had a nice house that they liquidated first, and that lasted for a while. But eventually, he's coming out of pocket $10,000 a month, $100,000 a year, and I don't think many of us can handle that bill.
Absolutely not.
But that's what people are facing, particularly as we live longer. My aunt never dreamed she'd live to be 93, particularly with, she had, it was called Waldenstrom's. It was a rare form of blood cancer. And when she first got it, they gave her 5 years to live. That's why she moved out to the desert to be closer to me and to her sister. Little did she know, 20 years later, she's still living. Through the miracles of modern science, she's still living. And so it's good. I always say it's good news and bad news. The good news is, yeah, I'm probably going to live to be in my 90s. The bad news is I'm probably going to live to be in my 90s. Who the heck's going to take care of me? And how am I going to pay for all this?
Right. A lot of our residents don't have family. A lot of our residents, they don't have, there is no generational wealth. And that's why they're in the position that they're in now. Right.
Right.
Nothing was left to them to help them survive, or, no property to sell. No, there is none of that. And they struggle every day. Social Security doesn't increase enough.
Right.
It's been a little often now, but it's not enough.
Right.
A lot of the residents, they don't have pensions. They have Social Security only.
Right.
And unfortunately, with this generation, a lot of the females, they were homemakers. The husband was the breadwinner. They stayed home and raised the kids.
Exactly.
Now the husband is gone and the wife is left with the minimal Social Security because they didn't work. They were at home being a homemaker.
Right.
And it's difficult. It's very difficult. But there are resources available. Someone just needs to know where to find them, how to get them, how to connect people.
So how do we direct? Where would you start? Where would you tell people to go look today to find some of those resources? How do we uncover them? How do we shine a light on some of them here?
For someone with zero experience, my best recommendation is to go to the senior center in their city.
Okay.
That is the best starting point because they have everything. They'll know exactly where to send you, exactly where to refer you, how to do it, help with the paperwork. I mean, that's the best place to start. Is the senior center.
That's one I never thought of. We never went. There
Mm-hmm.
were senior centers out there. I never thought of going to one of them out there. I kept going to the doctors. I thought the doctors are the front line. The doctors I found were poorly informed and not interested in telling us anything other than go put her somewhere here.
Yeah. In my experience, it's, the doctors, they have a job to do and that's fine. Everything they do is based on insurance. They're not really interested in providing anything other than what they're connected to. And that's sad. It should be different. Yeah. But that's how it is in our experience.
Those are my only two lines of defense other than just Googling stuff and asking people. That's how I discovered Borden Cares, by sort of accident. And there are those three levels of care that out there. There is independent living, which means you can make it down to the dining room. Basically, you can live independently, but you get this little tiny room and you move into this room and they provide meals and other sorts of things. And there are other services that you can pay for, but the basic charge just gives you room and board and food. But you got to get to the dining room and back. If you need assistance to do that, then you got to go into assisted living. And assisted living has somebody will do all these things. They'll give you a bath. They'll sort your pills. They'll do all that, but everything's with a charge. Everything's got a charge attached to it. And most of those you're looking at $4,000 or $5,000 a month and up. And then if you have any sort of severe problem, dementia, Parkinson's, Alzheimer's, something here, you're looking at easily 10 grand a month for specialized facilities to take it to basically just watch them.
Not doable. Not
doable
for a lot of people.
Yeah, right. And it's all out of pocket. There is no insurance to cover this stuff. Now, there is long-term care insurance, which very few of us have. We've talked about that before. If you get it early enough, it's affordable. But it's only going to supplement. It's going to pay for some of it, not all of it. It might give you
Right.
$2,000-$3,000 a month or something as a supplement to help pay for this. Mostly it's houses. Everybody we went, they said, well, she has a house, doesn't she? And I said, no, she lives in an apartment. She never bought a house. And everybody, that was the answer. Take the house, liquidate the house. That's what 99% of the people do. And then
Right.
houses have gone up. So you've got, $1 million, $500,000, $700,000 or something here. And that's what you take and run it down till it's gone. And some of these places even will creatively swap the house. We'll give you the house. I knew one guy did this, went to a facility, one of these long-term care facilities, and he said, you give us the house and we'll take the risk. If she lives 20 years, we lose. If she lives 2 years, you lose. But we'll just gamble. We'll take the house. It's like, who came up with this system?
It's horrible. And that also affects the generational wealth for the future generation, right? This house should be left to a family member to continue on in the family.
Exactly.
Right? So, no, I'm not going to give you my house, but I will give it to my family member, and then I'll have less assets, and now I qualify for your help.
The other, we've had people come on the show and talk about, so the other alternative is to do what I guess they did generations previous. Somebody stays home and takes care of grandma, aunt so-and-so, somebody here. Somebody takes care of this person, and then that's their full-time job as a caregiver. And that's hard to do. They're not set up to do that. They're not really don't know what to do. So they get frustrated and they get tired and they get burned out and they have no income. I've had people that say, we had one woman come on the show and she had to give up her career basically to move back in with her mom into her mom's house and find a new kind of lower paying job in that city because their mom needed her. And in this case, they did have a house, and mom didn't want to leave the house, so she moved into the house with mom. And I've heard people, it wrecks marriages. I'm over at my mother's house all the time. I'm not seeing my kids. I'm not seeing my husband or whoever, the husband, vice versa. It's a strain on the marriage. It's a strain on the family. It's a strain on the people. It's a strain on resources. I don't know why there isn't more talk about this. I went through it, so now I'm like a reformed alcoholic. I want to tell everybody out there, or reformed smoker, don't you do this. But oh my goodness, I don't know why this is going to hit us more and more. The baby boomers, especially here, we're not ready for this. We're not ready to live into our 90s and run out of money.
Yeah. Yeah, another option with the in-home support services is that a family member is able to apply to be a paid caregiver. There's a whole process for it. They can apply, then there's fingerprinting, and then there's like orientation and all this stuff. The pay is very low,
right?
But at least it is something. So if someone does have to stay home to take care of grandma or auntie, at least they could apply to be the provider and be paid for it.
Right. Any hope of this changing? Any legislation in the future? You guys are filling a void, but it's got to be a drop in the bucket here. Jamboree Housing, I'm familiar with the organization. We've had them on before. Great group of people finding low-income housing for everybody. Today, we're just focusing on the senior part of it here. Give me some size of the need. Give me some stats. How many people need this, and how many places have you got?
Well, so we have, the 4, let me think, 1, 2, 3, we have the 5 senior properties in Orange County.
And how many do those hold roughly? 100 people, a couple hundred people?
Oh, Huntington Beach is 164 units.
Okay.
Mission Viejo is 179.
Okay, so a couple hundred people.
Irvine is 360. We've got about 900 and something units, which converts into about 1,300 people.
Okay. And of that 1,300 people, well, how many people apply every year? Is there a long waiting list to get on this? Is it difficult?
Yes, the waiting lists are very long. Everyone just has to call, once a month and check in. Some people are on the wait list 2 years. Some people are on the wait list 5 years.
Yeah,
It
right.
all depends. Each unit has a different income limit. There's different area median incomes where people fit into. It just depends. A lot of people end up either not qualifying, they found something else, they had to go to long-term care instead. I mean, it's all different. So
Right.
you just never know when it's your turn from the wait list because things
So
change day to
imagine
day.
you've got the need today and you go on, you find the thing, you think, hooray, and now you're on a 2-year, 3-year, multiple year waiting list to get
Mhm.
grandma, to get your aunt, to get yourself into this facility. In the meantime, what? You struggle. Maybe you
Yeah.
even end up homeless. Maybe you even move out into the street or something, or into your car. Um, or you bounce around from one place to the next, somebody's couch to somebody's couch, and I'll take her for a while, and you take her for a while.
Yeah.
I think it's
We always,
I think it's a silent problem. It's and nobody I knew, nobody wanted to hear about it or talk about it. Oh boy, they'd run when I'd start bringing this topic up. Partly because we don't want to face it, we don't want to think about it, and partly because they didn't know either. They didn't know what to tell me.
right.
It was
A lot of people have it in their mind also that, I don't want this in my backyard. You want me
yeah,
to have low income housing in my neighborhood?
yes,
Oh my goodness, this won't be good. But really, it improves the area. It improves the area. It brings in money, taxes. I mean,
yeah,
it's everybody
the
is just
business.
afraid of affordable housing when really it improves the whole area.
Particularly for
Um,
seniors. I don't know why these board and cares are just a house in a neighborhood, and I'm sure they fought like hell to get it in there because everybody's like, I don't want those old crazy people living next door to my kids. Like, what are they going to do? Wander around and
right,
scare them like zombies or something here? My aunt didn't
right.
walk around the neighborhood, um, and it was so sad. Nobody. We have a mentality with old people anyway. Put them away, stick them away,
Yeah,
put them somewhere, and then they're safe, they're taken care of, and I can get on with my busy life, my difficult life, and I just know that somebody's taking care of them out there. I don't know who takes care of. Now, maybe is it easier in other parts of the country that are more affordable? There was a suggestion of moving my aunt back where she was from to Minnesota because there was more affordable care back there. And there were some cousins that kept saying, ship her back here. We can find a place here easier than you can find out there.
yeah. I'm sure insurances in different states are different. It depends on the income of the area.
Yeah,
It depends on the employment in the area. Everything is different everywhere, depending on, how much is rent actually out there.
right.
Um,
And how much
you
is
know, it,
land? That was the key question. If land was cheap in the Great Plains, then they could build cheaper facilities. If land is expensive, like it here is in Southern California, the cost of creating these facilities is exorbitant. Just buying the
right.
land, buying the building. That's why I'm amazed that you guys can do this at all. I mean, buying a building isn't cheap. Now, I know some of these are being donated. The cities have taken them over, or taken them back, or whatever. Is there more movement in that area? I think cities are desperately trying to find affordable housing.
Yeah, and there's some cities who are actually tasked with, they have to provide a certain amount of affordable units in the city.
Right?
And of course, each city fights it. The city attorneys, they don't want it in their backyard. But the state says, no, you have to do this. And so what we have seen, I live in Huntington Beach also. I follow a lot that goes on here. And
Huntington Beach,
they say, okay,
we had the mayor in here a while ago. He's a loud proponent of not my backyard, not in this neighborhood. We're not going up. We're not bringing that stuff here. We're going to sue all the affordable housing things. We're fighting back and everything. We're not going to change the community in any way, shape, or form to accommodate any of
right.
this.
I think people are just uninformed. It scares them, and they just don't have enough information. But we have properties in Huntington Beach that are low income. We also have some that are moderate that are not ours. They're not ours per se, but the city was required to
Right.
provide moderate income, which to them makes them feel better, right? Because moderate income is 80% and up, 80% to 120% of the area median income. So, those people are a little better off. If my income was 80% of the area median, I wouldn't need to rent an apartment. I could probably purchase a home,
Right.
probably inland, but still, if I had that high of income, I wouldn't need what everyone else needs. And so, but to them, they're fixing the problem because we provided this moderate income, when really the problem is 50% AMI and below, which is people on Social Security.
And what's AMI
people,
average? What average median?
Area median income.
Area median income. Okay.
Yeah.
And what's
So
the area
affordability
median
of things.
And what's the area median income in Orange County? I don't even know what it is. Got to be 100,000 or something, or
let's just say, for example, a family of 4.
right.
At the 50% area median income, they make about 60,000. If they live in affordable housing, they can make up to 120,000, and then they wouldn't qualify anymore. So they would have to go to the next level.
Am I the only one that still thinks that $100,000 sounds like a decent income here? You're saying that's enough to, if you make $80,000 a year, the new Ford and GM contract's going to guarantee factory workers a salary of around $80,000 a year after a couple of these bumps take place. And you're saying that's not enough? That's low income?
It's not enough. It's low income. Anything under 120,000 is considered low income.
Wow. But let that wrap around your head a little bit. How many of us make over $120,000 a year? Some, clearly,
I wish I had that percentage for you. The Orange County United Way just put out a report on how much it actually costs to cover basic needs for, a family of 4, a family of 2. It is on their website. Maybe I can share it. I'll share it with Dr. Trinh and he can get it to you. But
there you go.
It's absolute, just to cover basic needs. A family of 4, I believe, was at the 120,000, and that's only basic needs: childcare, housing, transportation, basics only. It's absolutely horrible. So imagine for a senior with one single income, like you said, they're getting $2,000 of Social Security, but to meet their basic needs, they need at least $4,000 a month, and they don't have it.
I think that's the key. You need to have about $4,000 or $5,000 a month income, and the majority of us, at least in my generation, aren't going to get. Not going to get any. I'll get Social Security. We hope, if they don't screw it up, but we're not going to get any pensions. That got wiped out in my aunt, father, mother's generation because they did live for 40 years. My aunt, I used to tell her, kidding, I said, "You're the one that screwed it up for the rest of us here." She got this little pension as being a secretary that was unheard of today. And, she retired after 40 years there. She started when did she start? Like around 1930. She retired about 1970. And then she died 40 years later. She almost lived on her pension as long as she'd worked. She worked for 40 years for this company as a secretary. And I think they paid her the next 35 years or something, her little $1,500 a month pension or whatever it was here. And I said, that's why companies gave up. We're not going to pay you a pension for 40 years, for 20 years, for 30 years. So now it's a 401k. We'll match it, but it's up to you to save and you're on your own once you leave us. And so that's the place most of us are in. Now, housing certainly helps. Those are that got in the housing. So we've got these $1 million properties that I guess we'll liquidate. And that's our answer. But
horrible.
It's a giant problem that I can't shout loud enough about because I saw it firsthand and I was shocked. I kept saying, why isn't everybody talking about this? So today we're talking about this. What else do you do with these people to help them in your facilities? Once they get into your facilities, they must feel like, at least I got someplace and somebody that cares about me and somebody's going to watch out for me and look out for me and stuff here.
We provide a lot on site. And so if you can imagine, say, for example, an assisted living facility, right, that you pay $5,000-$6,000 for a month. Right. There's an activities director there. That activities director is paid a lot of money, but they're also able to use the budget, because everyone pays so much money to live there. They're able to use this budget to do activities and whatever it is they want. Right. Take them shopping. We don't have that luxury. And so we have to make sure that we're building partnerships with community organizations, like Dr. Trinh, Council on Aging. We have a lot. UCI students do volunteer time, Meals on Wheels, Second Harvest Food Bank. We build partnerships in the community to come in and provide services. But those of us on site also provide services. We do like arts and crafts. There's exercise classes. There's a puzzle table. We do game day, all different kinds of activities so that everyone is either using their fine motor skills.
Right.
They're using their
Get them out of their
thinking.
bed. Get them out of their room. Yeah.
Yep.
Right.
Come into the clubhouse. This is what we're doing today. There's an activity every single day, well, Monday through Friday, for them to come in and enjoy their time. There's food distributions, that way they're getting some free food so that they can spend less at the grocery store and get other things that they need.
Right.
Toilet paper, cleaning supply, whatever it is, clothing, shoes,
And when they come into your facility, are these free to them or do they still pay something?
No, everything is free. Everything is free to the residents. There's no charge for anything.
Wow.
Yep. So it, also helps them save money, right? They can do an exercise class on site instead of having to go and pay for a gym membership.
Right. And that's the other problem that my aunt ran into, and I think all these facilities, not the more premium facilities, they'll transport you to the doctor, they'll take you shopping, they'll do things. But if she wanted to get out, she couldn't drive anymore. She had a car that she wouldn't give up, but she really shouldn't have been driving it and couldn't drive it very much. And so somebody had to get her to the doctor. Now, yes, a lot of these Medicare Advantage plans will give you transportation in and out, but it was a car. And somebody, trying to get my big, heavy-set aunt feeling like she's falling and everything else, screaming and howling as you try and get her into the car here. She really needed wheelchair transport, but that was almost never available. And so there were many instances that she fell and she got hurt. They were trying to pick her up and take her to the doctor. So I'd mostly have to run out there and take her to the doctor. We'd schedule it and we'd try and do all of them in one day. And, all these workarounds, these creative ways people find ways to soldier on, to keep going here. I can't say enough about the good work that you do. Do you have places out in the desert or is it just here in Orange County?
We have a family property out in the desert, not a senior community. What city is it? It's all the way out there.
I just because that's where so many of the seniors.
Coachella.
Yeah.
Coachella Valley somewhere.
Yeah, Coachella, that's all that whole area of Palm Springs to Palm Desert and Indio and everything in there. So many people moved out there and there's like great hospitals out there, lots of doctors out there, lots of seniors out there in these senior areas where seniors move because it was cheaper and it was warm and all these things there. But I was shocked. I thought there'd be lots of facilities. Couldn't find any. Lots of premium facilities, lots of nice facilities, lots of expensive facilities. No shortage for the people with money. And it can be a nice existence. Some of these places are beautiful, wonderful, lots of movies and all sorts of things. They have on-site hair parlor, hairdressers and stuff here. I wish I had that kind of money to do that. I don't know how people are going to do that. I guess they're going to liquidate their house and take all that money and pour it into, which then, as you said, affects the next generation that's not going to have anything passed down by grandma or your parents or whatever here. What would you tell people about, what message do you want to get across today? This has mostly been my story and my shock and my sounding the alarm here to people. What message is there a message of hope? Is there a message of, is there a bright star in this, or is this a problem that needs to be addressed better?
I mean, yes, it's a problem that needs to be addressed, but what we can do in the meantime is advocate for change. If you yourself or a family member needs help, the first stop that you should do is the senior center in your city. Okay. They will guide you to exactly where you need to go based on what it is that you need. But definitely, we always need support. We need support of affordable housing, especially for seniors. Right. We need advocacy for Social Security to be raised. If that's the only income that people have. Right. We always need advocacy and support. It's for your grandma, your auntie, and
you eventually, and other creative ways to provide transportation. Transportation's a huge issue. How do you move this population around, back and forth to the doctor, back and forth to the hospitals, back and forth to shopping, back and forth to everything here? I don't know that we've thought through that enough. Self-driving cars may help that someday, or taxis can come just pick them up and do something here. But transportation's a huge one. medical care, the people like Dr. Trinh that go out and give health talks or maybe do clinics at your facilities and others. These are people that we need the services to come to them.
Yes.
Otherwise, we get them because we don't live in everything's spread out. They can't walk and they can't drive. So how do they get to and fro to all these places here? And I think that we need to have some kind of conversation. Orange County is rapidly aging. I've seen shocking statistics. I'm making this one up, but it's somewhere close. Places like Newport Beach, Newport Cove, all these expensive neighborhoods, they're already like 30% seniors. And it's only going to go higher. It's
only going to continue to grow.
Yeah. So
yeah.
You've got these communities that are suddenly aging in place rapidly. And do they have the transportation? Do they have the hospitals? Do they have the senior centers? Do they have the senior services? Do they have a way to pay for these things? Do they have I don't know that they've built that infrastructure. If this is the new face of Orange County, if it all looks like one big Laguna Woods, Leisure World, Sun City or something, that's where there's going to be there is a huge population already in place here. And it's only growing as we live longer and we don't leave. We've got the house that we bought 1 million years ago and paid off. Where am I going to go?
Right. We definitely need our neighbors to look out for our other neighbors.
That too.
Right.
That too.
Be knowledgeable. Get the knowledge from somewhere. Attend a presentation. Get the knowledge to be able to look out for your own family members or your neighbors. Have the resources available. Know where it is that you can go for this person. Advocacy is number one. Knowledge is number one. Advocacy is number two. Know what to do.
And number three is looking out. Dr. Trinh had somebody on. I wish I could remember the name of the organization. I think it was through Hoag Hospital. But they had women who went out and basically kind of, nurse nightingales. I kind of picture it. They went out looking for people in need. And so they talked about, for example, through churches. I think this was a faith-based group. And how many people notice the little old lady I'm Catholic, so she comes to Mass every week, but nobody talks to her. She just sits in the back row by herself. And all of a sudden, she doesn't show up. Do we know her name? Does anybody bother to check in on her or something? Do we say hi to her? And we see her there. You notice her there, but do we do anything to pay attention, to call her, to reach out? That's kind of what these people did. They would kind of identify these people because most of these people, they're around us, but we don't know them. You don't stop and talk to that little old lady across the street there or in the apartment upstairs or that you see at the grocery store every week or something. And then suddenly you don't see them. Maybe they fell. Maybe they're in need. Maybe they're in trouble. We've got to do a better job of looking out for one another.
Absolutely. Absolutely. The Council on Aging has a program. It's called the Friendly Visitor Program. But, it's only for people who are signed up, right? So no one's going to know about it unless they know about it.
Yeah.
But that's how it should be like that across the board. Looking out for your neighbor, asking them how they're doing. Is there anything that you need? And then getting them connected if they need connections,
right. I wish there was a very visible, maybe the senior centers are that place. I hadn't thought about that. This one resource, very visible. Everybody knows where it is. You find it and you walk in and there's this plethora of volunteer groups or government services or special programs that are being set up, free ride share programs or other sorts of things. And just others to talk to and say, hey, try this. I do this, where you can share information and whatnot and take them and take yourself and educate them. I guess it is a senior center. I guess I don't pay enough attention to those out there. Something about senior centers. You just don't go into it until you're a senior, I guess, or something.
Right. Right. Anyone can go and get the information that is needed. And they welcome that. They welcome, the younger generation going and getting information for their elderly neighbor. It's highly beneficial. Go in there, check it out, see how it even looks. How do they run it? What's going on, what's available.
Yeah. There's
multiple transportation options available too. Nobody knows. So the neighbor's not going to know either,
Yeah, exactly.
and they're free. Most of them are free. There's a few, that charge a tip or whatever. It just depends on your income.
We need to create, maybe Jamboree could do that. We need a one place site that lists all this stuff here, a resource page, and it should be titled, in trouble, need help, come here, start here.
Well, if you're in trouble and you need help, call Allison. Call me.
All right. And how do they reach you, Allison? How do they get you?
Dr. Trinh has my information. Otherwise, I do have, my phone number. My phone number is 949-208-3909. And my email is acuff@jamboree, JAMBOREE, housing.com.
You put yourself out there now. People are going to write this number down. They're going to call somebody because I didn't know where to call. I didn't have that starting point. I wished somebody 10 years ago there was an Allison Cuff around that could have said, here, I'll spend 10 minutes with you. Let me give you 5 resources, 3 places to go, 2 programs to check out. And then you start the journey and one leads to another here. But
yeah,
I went to the doctor and that was a dead end.
Yeah. Give me a call. Send me an email. Resources are my specialty. If you give me a call, the first thing I'll ask you is what city you're located in, and I'll know exactly where to send you. It's my thing. It's important to me. For whatever reason, I can just remember these things because it is definitely important to me. And so absolutely, if you need help, give me a call, shoot me an email, and I'll get you directed to where you need to go.
Give us the email one more time. Let's start with that one. Cuff, was it for Allison Cuff? ACUFF
exactly.
at Jamboree.
Housing.com.
Okay. And then they can find more about Jamboree Housing. I don't think you guys are well known either. I'm sorry to say. I don't think most people know that you guys exist. I didn't know till somebody came on one of our shows that there was such a place.
Right. I'm really surprised. Yeah. Our website is also jamboreehousing.com. Our website is very user friendly. You can filter searches by city, by property. If you want to look at just senior, you can filter it that way. If you want to look at family, you can look at it that way. You could do it based on city. We're all over the place. And our website is super easy to use. There's also other, there's reports, there's, our mission and our vision statements. Everything is on there and it's very informational. Yeah.
I'm glad we got a chance to everybody listening to the sound of my voice here. Take it upon yourself. Go find a senior somewhere in your community here. Somebody you notice. Say hi to them. Get to know them a little bit. See if there's something you can help. And now you got someplace you can tell them, hey, check this out. Go over here. Go to the senior center. Go to Jamboree Housing. Call Allison Cuff here. Just that little bit of dissemination of information, what an effect that could have if we all took that upon ourselves to just talk to one senior this week here. And
absolutely
check in and see what they needed and maybe say, hey, I heard something. Maybe this can help you here.
Yes, absolutely.
All right. Thank you so much for coming on. I think it's a big problem. It's only going to get worse as the baby boomer crests, as my generation moves from the 60s into the 70s and the 80s and beyond. I don't know that our kids are ready for it. I don't know that we're ready for it. I don't think the country and the county's ready for it, but we're coming. And we
can get ready now. We can get ready for it now.
Yeah, exactly. Here. Thank you so much for joining us today and helping us sound the call here.
Thank you so much. Thanks for having me.
Well, there you have it. I don't want to sound like we're sounding the alarm, but today we are. There is a silver tsunami sweeping across the country. And if we're not ready for it, it's going to drown an awful lot of us here. Lots of resources, lots of things to talk about and think about this week on Health Talks with Dr. Trinh.